Hello and welcome. In this video, we will briefly be discussing high blood pressure. We will cover what it is, the main causes, and some ways to manage this condition. If you believe you have high blood pressure and its associated symptoms, please schedule an appointment with your primary care provider immediately. High blood pressure should not be overlooked by any stretch of the imagination. Your health and well-being is of paramount importance. If you never considered the role of your blood pressure and your health, now might be a good time to do so. This video will provide you with a basic understanding of high blood pressure from a general standpoint. If you want more detailed and scientific information, please consider reaching out to your local healthcare provider for an appointment to address your concerns. High blood pressure, also known as hypertension, is a condition in which the force of the blood against the walls of the arteries is consistently too high. Blood pressure is determined by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. When your heart pumps more blood and your arteries are narrower, your blood pressure increases. Hypertension often has no symptoms, which is why it's called the silent killer. Over time, if untreated, it can cause health problems, including heart disease, stroke, and kidney disease. Managing blood pressure typically involves lifestyle changes, such as diet and exercise, and sometimes medication. There are many causes of high blood pressure. High blood pressure, hypertension, can be caused by a variety of factors, which are often categorized into modifiable and non-modifiable factors. Some non-modifiable factors are genetics. If you have a family history of high blood pressure, then you could be at an increased risk for developing high blood pressure as well. Age is a factor because your blood vessels lose their elasticity as you age. Race plays a role too. High blood pressure is more common in African Americans and develops at earlier ages within this racial demographic. The modifiable factors are things like diet and exercise, alcohol consumption, smoking, stress, and sleep apnea in some cases. Many people with high blood pressure may not be aware of their condition until it has caused significant health issues. However, when blood pressure reaches high levels, it may cause headaches, shortness of breath, nosebleeds, chest pain, dizziness or lightheadedness, visual changes, and irregular heartbeat. These situations require immediate medical attention. So, there are some types of food you should avoid. If you want a dietary plan geared towards your specific needs, then it may be best to seek consultation from a registered dietitian and/or a nutrition counselor. These individuals will be able to guide you in the right direction. Here are just a few food items you should consider removing from your diet entirely, or at least reduce your consumption of these food items significantly. Those food items are salt, processed foods, foods high in saturated fats, sugar foods and drinks, alcohol, and high amounts of caffeine. As a side note, hydration is very important. You should aim to drink at least 1 gallon of water every day. If you are pregnant, then this requirement jumps up to 2 gallons a day. Paying close attention to your nutritional intake will definitely yield many benefits for your health in the long run. High blood pressure or hypertension is based on numerical thresholds. A normal blood pressure is 120 or less over 80 or less. Elevated blood pressure is when the systolic or top number is between 120 and 129, and the bottom number or diastolic number is 80 or less. Stage 1 hypertension is when the systolic number is between 130 and 139, and the diastolic number is between 80 and 89. A hypertensive emergency is when the systolic number is 180 or higher, and the diastolic number is 120 or higher. If you happen to take your blood pressure at home and see any of the latter readings, please seek urgent medical attention. High blood pressure places enormous pressure on the heart. When you have high blood pressure, the heart has to work with an increased workload. You may also be at risk for damage to your arteries, heart attacks, heart failure, arrhythmias, which are irregular heartbeats, reduced blood flow, and an enlarged heart. All of these occurrences are detrimental to your health. Aside from prescribed medication from your healthcare provider, Starting an exercise regimen will help manage your high blood pressure. Start with strength or resistance training at least 3 times a week. Push-ups, pull-ups, sit-ups, dips, squats, and lunges are all exercises that you can do at home with no equipment. These exercises are great to get started if you haven't been to the gym in some time. Russian twists, planks, leg raises, and crunches should be staple exercises for your core workout. Performing these exercises in a circuit will help to raise your core temperature, which in turn helps to burn more calories. Your workouts should be no longer than 30-60 minutes per session. Rest and recovery are important tools as well. Taking a day or two off in between your training sessions will allow your body to recover and repair itself with bigger and stronger muscles. Over time, your increased muscle mass will help your metabolism and give you more energy throughout the day. In summary, high blood pressure is a silent killer. Remember to check your blood pressure at regular intervals. Having high blood pressure can lead to other health complications. The underlying explanation behind high blood pressure is your heart is working harder than it should be. This is not a sustainable function for your heart in the long run. If you have any questions, comments, or concerns about your blood pressure, schedule an appointment with your primary care provider. If you are prescribed medication, always remember to take your medication as instructed. Any further questions, comments, and/or concerns about your high blood pressure medication, reach out to your local pharmacists and/or your primary care physician. I hope that you enjoyed this video and now have a basic understanding of high blood pressure. If you did, please continue to support this type of educational content and share this with your friends and loved ones who may need this information. See you all in the next video.